Hello, hello. Today we're going to talk about what is neglected dentition. So, neglected dentition, the learning outcomes, what is neglected dentition, and facts to know. So, neglected dentition happens to people when they decide not to have anything to do with their teeth. They don't take very good care of it. They end up with poor oral hygiene, a lot of decay, broken teeth, and missing teeth. It's like they don't really care about the state of their mouth, and that can sort of affect their confidence. Some people end up with gum disease and then bone loss. As you can see in the x-rays, when you have bone loss, the teeth become very loose and you lose it. And then there's facial changes. When you lose teeth, your face falls in. That's why it's very important to have your teeth. You end up with wrinkles and things in your face, and you don't have shape. So your teeth are very important to give shape to your face. And one fact you need to know about is the summary is there's always poor hygiene, retained dental roots, and missing teeth. And when you look at this radiograph, you can see a very big cavity on the lower right first molar because the x-ray is facing me and it's very close to the nerve. So when you have a small cavity and you go to the dentist, they fill it. And if you ignore it and it hits the nerve, as you can see in the uh, x-ray, and it hits the nerve, then the complications are pain, Rick's pain, alternative do nothing, or root canal treatment or extraction, or the benefits is function and the pros and cons. So if you have a tooth that is decayed and it hits the nerve, what you're saying is, oh, I want to save the tooth. That is have the root treatment, but you can still have the root treatment, end up losing the tooth, or you end up having the tooth removed. But when you have the tooth removed, you may end up with a gap and then you need to replace it with something more expensive. And that can be quite draining and then it will affect your smile line. So that is why you have to think carefully and prevent it in the first place. And if you have a missing teeth, especially if it's in front, it can affect your confidence. I don't know if you've noticed there are some people they don't like smiling, and then when you ask them if they are honest with you, they'll tell you it's because they are not happy with the state of their teeth or they have a gap in front. And then there's at times too you may experience facial swelling around the angle of your mandible. When that happens and you don't go to the dentist for antibiotics and it spreads and affects your breathing, you need to go to A&E because it means you may need intravenous antibiotics. So when you see any unusual swelling on your face, please go to the dentist because it could be hereditary, it could be an infection, it could be an abscess, it could be anything. Please go to the dentist to diagnose what is causing the problem. And prevention, as always, prevention is better than cure. So it's very important to brush twice a day using toothpaste and clean twice a day and floss and limit sweet to meal times. You can use the special brushes to clean in between your teeth. If you cannot floss, you can use interdental brushes. And prevention, the only way to prevent neglected dentition is to brush twice a day. Try and floss. Limit sweet to meal times. If you're having any drinks or anything that's acidic, use a straw and download the food scanner app because it tells you how much sugar in everyday food. Visit your dentist regularly and visit your hygienist regularly. I'm sure you'll be happy to have beautiful teeth like this instead of neglecting them. So please take good care of it. As always, this is just for information purposes. Thank you for staying and see you in the next video.